This is the central line dressing change skill. For this particular skill, so that you have the best view, I have the patient sitting way up in the bed. You don't necessarily need to have your patient sitting this far up in bed. I'm going to wash my hands. I would raise the bed to about my waist level so that I'm comfortable and not leaning over to do this procedure. Explain the procedure to the patient. There's a couple things that you need to remember before you get started. One thing is you want to have the patient turn their head away from the dressing site, and this is a right subclavian central line dressing change that we're going to do today. So certainly if the patient follows commands and can understand you, you can just ask him, please turn your head away. If you have a confused patient that can't follow your direction, you may need to actually put a mask over the patient as well. And in that particular case, you're probably going to need someone else in the room too, because they may tend to reach and grab and break the sterility of the procedure. So I have the patient's head turned away. I've washed my hands. I need to get my clean gloves. And the other thing that I need to do that sometimes students forget is I need to open up my kit right now, because inside my kit is the mask that I need to put on. And I need to put the mask on before I start to take the dressing off. So I'm going to open up the kit, being careful not to touch any of its contents. I will need to, in order to get to the mask, I will need to take the gloves out, and I'm only touching the gloves, the sterile gloves, and then my mask is here, and I'm careful just to touch the mask. This is my sterile field now. Okay, so I'm going to go ahead and put my mask on. There's a little bendy piece in the top that should go over your nose, and then you can kind of squeeze that, and it helps to stay in place a little bit better. You need to make sure your nose and your mouth is completely covered though. Okay, so I have my mask on, my patient's head is turned away. I'm going to put my clean gloves on and take the old dressing off. So I'm taking the old dressing off. You'll find that the tegaderms really stick to the mannequins. They hopefully won't stick to your patient this much. But do try to remember that you need to pull the dressing off toward the insertion site. Most of the time your central line dressings, your central lines will be sutured in place, but not always. You may come across one that has no sutures in. Maybe it was done in an emergency situation, and you need to be very careful either way not to pull the catheter out. You need to make sure when you're taking this dressing off that you do not touch anywhere under the area that was covered by the dressing. Okay, so you notice I have my fingers out here. This is not covered by the dressing. I'm just giving a little bit more support by touching the tubes. There's a piece of tape under here, which I'm going to leave in place, and for we're just going to pretend for purposes of videotaping that those are the sutures. Otherwise, these pull out pretty easily. Okay, so I'm going to go ahead and take off my gloves. And I'm going to don my sterile gloves. Remember, this is my sterile field, so before I reach in there, I need to have my sterile gloves on. Now, the gloves that come in the central line kits are one size fit all. And we know that that's not always the case. So if you have large hands, you may want to have your gloves nearby. A lot of students open these up and are like, oh, I'm not using these, because they look like they're kind of all crumpled up in there. They're not packaged the best, but they're still folded the correct way, and you can still get them on without contaminating. So I want you to practice and try, not just look at them and say, nope, I'm throwing these away. But you pick them up in the same way that you do the surgical gloves. Keeping that thumb out while I'm pulling on. Okay, so you'll see in this kit that I have a pack that has an alcohol swab or swabs. This one has one. You may have a kit that has 2 or 3. Use whatever you have. Use all of them. If there's 2 or 3, I'd use them all. I have one. You're going to clean with the alcohol first. And the way you clean with the alcohol swab is in a bullseye fashion around the insertion site. So I'm going to start at the insertion site, and I'm going to work my way out around in a bullseye fashion. You can go over top of the tube. Just try to make it kind of one continuous move. Don't be doing a lot of picking up and putting down, then you lose track of where you picked up and put down. Okay, the real cleaning comes with the chlorhexidine. So I'm finished with the alcohol. I will let the alcohol dry. It will take a while on a mannequin, so you can just say on your videotaping or your check off, I'm going to let the alcohol dry. It's important to let it dry on the skin, and then I'm ready to clean with the chlorhexidine. This is the chlorhexidine. What you need to do for this is actually squeeze the little wings. That breaks the ampule of the chlorhexidine inside and moistens the sponge. Okay. Chlorhexidine came out, it's been years, probably 5 or 8 years now. And when it first came out, we were kind of like, what? What do you mean scrub back and forth, up and down, round and round? It's because of the properties of the antiseptic. That's how it works, by using friction. So this is the only solution, to my knowledge, that you don't have to use a bullseye method for. And this is what you're really going to be able to clean well with around the central line insertion site and around the area. So I need to clean for at least 30 seconds, up and down, round and round, over top the tube, underneath. Sometimes there's a crust of blood that forms around the sutures. You want to make sure that you clean all of that. And at least 30 seconds. So I need to make sure I'm looking at my watch or the clock on the wall. The dressing that I took off of here was pretty small. The one in the pack is larger, so I'm cleaning in a pretty big area. I'm also cleaning down the tube a little bit as well, because more of the tubes are going to be covered with this dressing that I'm about to put on. So go ahead and clean down the tube around. There's no need to clean way over here, obviously, but give yourself a good area. The entire time that I'm doing this or taking dressing off, I'm also looking at the insertion site, looking for any redness, excessive swelling, looking at the condition of the skin. Some people are very sensitive to the dressings that are on there. And I'm going to take note of that. Also, if there's any drainage around this site, that would be important to take note of and document. And certainly if there's drainage, to let somebody know, because more than likely that is infected. So my 30 seconds is up. I'm going to allow that to dry. I'm going to get my dressing out of my kit. I don't really need anything else that's in here. There's some gauze, there's a Q-tip. There's some skin prep in here, which may come in handy if you have a patient that's really diaphoretic, or even not. It's nice because skin prep is just, it looks like a little alcohol pad, and it just helps the skin become more tacky so that your tape or your dressing will stick a little bit better. I'm not going to use it for the mannequin, or it may never come off. I'm going to let that dry. Again, the mannequin's not going to dry completely, but you would want the patient's skin to dry. Your Tegaderm has a paper back on it. You'll peel the paper back off, and then you have your window where your insertion site is going to be. You want to make sure that that part is over the insertion site so that it's easy to view or to see. And I'm going to place this over the insertion site. And I have that pretty wet, so it may not stick really well. I'm going to try my best to make a nice seal. It's going to stick better to the patient's chest. You're not going to have these kind of air pockets in here because the mannequin's not very pliable and it doesn't adhere to the plastic mannequin very well. And then you need to peel this paper off. There's a slit down here at the bottom, or wherever you put the slit. It could be at the top. I usually put it down by the tubes. And you're just going to begin to peel that off. I follow my other fingers behind it so that I make a nice seal to the skin. On the paper, there's actually a little piece of paper tape label that you can pull off. And you can time date and initial. Again, it's covered, sterile part of the procedure is over. I would time date and initial that and label it. I usually put it down by the tubes to kind of give them some extra stability as well. and then you're finished.